Hello, I am khaja asifullah from Government Degree College, Kalakuma, Hyderabad. This is a video lesson prepared for semester 6 students of BSc, that is final year students, and the topic is medicinal chemistry. In that, today we will deal with disease and drugs. So today we will mostly discuss about disease. To understand disease, let us first understand what is health. According to WHO, that is World Health Organization, health is a state of complete physical, mental, and social well-being, not merely the absence of disease. WHO defined health as not merely the absence of disease, but it is state of complete physical, mental, and social well-being. Now we can understand disease easily. It is the deviation of a body from the health, or it is a particular abnormal condition that negatively affects the structure or function of all or part of an organ. It may be the whole body or a part of organ, and that is not due to any immediate injury. Diseases are often known to be medical conditions. So a disease is nothing but a medical condition that are associated with specific symptoms and signs. So every disease will have a specific symptom or sign, or they may have more than one symptoms and signs. A disease may be caused due to external factors such as pathogens, means some microorganism may cause a disease like virus or bacteria or fungus, etc. Or it may caused by an internal dysfunction. Example: diseases like typhoid, malaria, flu, dengue, etc. are caused by pathogens like virus or bacteria. So, virus or bacteria are responsible to cause a disease like typhoid, malaria, flu, etc. Internal dysfunction of immune system can produce allergy, hypersensitivity, etc. Diseases are of different types. So there are different types of diseases like biological disease, physical disease, a mental disease, or psychological disease, hereditary, and deficiency diseases. These are the different types of diseases. A disease may also be defined as deviation from normal health conditions of the body. So whatever the normal conditions a body exhibit, or it has, if some deviation is observed from those normal conditions of the body, then we can say that there may be a disease in that body. That means an animal, including a man. One more definition for a disease is a disease may also be defined as any condition that impairs the normal functioning of an organism. If a body deviates or impairs from the normal functioning, then it may be called as a disease. It is a pathological condition of a part of the body or of an organ or a system of an organism, what resulting from various causes such as infection. What is the meaning? The whole body may have a disease, or a particular organ of the body may have a disease, or the system. For example, if we consider a particular organ like heart, we may have disease of heart disease, or maybe a system like blood, like BP, low BP or high BP, due to the flow of blood. These diseases may be due to infection. Diseases are mainly of three types. Means now we will discuss different types of diseases, and diseases may be categorized in different ways. One such type of categorization or classification of disease is as follows. Number one is, it may be contagious disease. Number two, it may be a non-contagious disease. Or third, diseases caused due to unknown reasons. So these are the main three types of diseases. Number one, diseases that spread from person to person are called contagious or infectious diseases. For example, cold, flu, plague, and the diseases of the disease of the day, that is COVID-19. These diseases may spread from person to person. That means if an infected person is present, then another person who is living in that atmosphere or just adjacent to him, or whoever is meeting him, may also catch that disease. Due to that, that the other person or healthy person will also become. The second type of disease is called non-contagious. Diseases that do not easily spread from person to person are called non-contagious diseases or non-infectious diseases. It may require vector like mosquito, etc., to spread a disease. For example, like diseases like malaria, dengue, etc. In this type of diseases, these diseases are not directly catched by person, but some other thing is a mediator or in between two persons, which is called vector, like mosquito is required. In that case, these mosquitoes are called host. They will carry the germs like virus, bacteria, etc. When they bite the infected person and suck the blood, and again when they bite the healthy person, the disease may be transferred from one person to another. So these are called vectors, and the diseases which spread in this way are non-infectious or non-contagious diseases. Among them are malaria, dengue, etc. It may be the result of sharing the environment, means the people who are living and may share equally the environment like food, water, toilet, room, home, or any other place, workplace, or public places like cinema halls, gardens, etc., or workplaces like office, etc. And there may be spread of disease like typhoid, food poisoning, etc. Here in the case of typhoid, because it spread due to water, the germs are present in water. If there are people who are sharing the environment, are living in one room, home, or office, and if they drink the same water, the disease may be carried from one person to another. Similarly, food poisoning is another example of this type, where we share the food, means all people who are living together or attending a function may commonly eat the same food or they share the same food. As a result, all may be catching the disease. The third type of diseases are of diseases of unknown origin, such as Alzheimer, diseases whose cause is unknown. The Alzheimer are the type of disease whose cause is unknown to us, are the third type, in which the cause of disease is not known. As a result, we cannot treat, or it will be very difficult for us to treat the disease or the person who is having that disease. We can classify or categorize diseases into different classes based on different things. Here, we may also classify the diseases on the basis of microorganisms which may cause disease. We know virus, bacteria, fungus, and other microorganism causes diseases. For example, we may have diseases due to virus. These are called viral diseases. Few diseases which are called viral diseases are HIV, AIDS, COVID, etc. All these are fatal diseases, means that there is much more death rate in these type of diseases than other diseases which are curable easily. The other type of diseases are diseases caused due to bacteria or bacterial diseases. Diseases like leprosy, cholera, etc. are the example of bacterial diseases. Leprosy, cholera are also fatal diseases. These were fatal diseases, including malaria also. But nowadays, these are very much in control because many drugs are there to cure these diseases. In modern days, we can cure malaria easily, leprosy also can be cured, cholera can be controlled. And sometimes fungus may cause disease, therefore, this type of diseases are called fungal diseases. Fungal diseases affect hair, nails, lungs, and other part of the body. Many parts may get affected due to fungus or fungal diseases. The other type of diseases are due to heredity disorder or due to chromosomal disorder. One such example is called Down syndrome, which is also called as Mongolism. In this type of diseases, there may be disorder in chromosomes, such as absence of certain chromosome, or it is due to excess or shortage of chromosomes or pair of chromosomes, or sometimes due to defective chromosome. Diseases may also be classified on the basis of medium in which the disease is transmitted. Generally, a medium is required to transmit the disease, especially for infectious disease and also in most of the non-infectious diseases also. What is the medium? Medium here maybe air, water, or food, or insect, etc. These, especially these three, four medium, spread the diseases. Why? Because the germs which may cause or microorganisms which may cause diseases will spread in air or in water. They are present, or sometimes in food, or sometimes insect like fly, mosquito, etc. will carry them these diseases. Rarely animals like rat, dog, etc. may also cause diseases when they bite the other animals or man, or including man. So insects and animals also transmit the diseases. Therefore, a medium is certainly required to spread diseases. Therefore, we can classify diseases on the basis of the medium, like airborne diseases. The airborne diseases means these diseases will spread due to air, means the germs or microorganisms which cause the disease or pathogens are present in air. If they are present in water, these are called waterborne diseases. Similarly, if the host are insect, means that germs or microorganisms like virus, bacteria, etc., are present in insects like fly, mosquito, etc. These are called insect-borne diseases, etc. I will give you different types of airborne diseases, waterborne diseases, insect-borne diseases, etc. at the end of the lecture. But sometimes diseases may also be caused due to deficiency diseases, means deficiency of vitamins or minerals, etc., in the body of an animal, including man. If a disease is caused due to deficiency of something like vitamins or minerals, then these are called deficiency diseases. For example, we may have man may have deficiency diseases due to the deficiency of vitamins. For example, blindness or many other diseases are there. For example, if there is a shortage or deficiency of vitamin A in a body of a person, then there may be a disease of vision. Some person may have deficiency due to this disease due to deficiency of vitamin A, color blindness, or any such type of disease. Similarly, anemia is caused due to deficiency of vitamin B. Similarly, there are diseases which are called deficiency diseases due to vitamin D, C, K, E also. Sometimes skin is affected, sometimes the other part of the body is affected due to deficiency of these vitamins. Similarly, our body needs or require minerals and metals like sodium, potassium, magnesium, calcium, zinc, cobalt, iron, etc. For example, iron is present in blood, especially in hemoglobin in the blood. If there is deficiency of iron, then the hemoglobin will be less in blood. As a result, the person is called anemia or anemic patient. And if calcium is less, then our skeletal bone, the main mainly calcium is stored in teeth and bone. Therefore, we require calcium. Similarly, sodium, potassium, magnesium are also required for our body. Now, what are general diseases which are called airborne diseases? Chickenpox, smallpox, monkeypox, measles, TB, SARS. SARS stands for severe acute respiratory syndrome. Most of the respiratory diseases are airborne diseases. Whether these are the diseases SARS or MERS or swine flu or COVID, etc. These diseases spread in the medium called as air. The germs or the virus, bacteria, etc. are present in air, and when we breathe in the atmosphere which is infected by the germs, we may also catch that disease. Next is waterborne diseases. Generally, we have typhoid, cholera, diarrhea, fluorosis, hepatitis, ringworm, hookworm, lead poisoning, etc., which are called as waterborne diseases. In these diseases, most of the diseases are fatal. If typhoid, if we consider typhoid, if it is not detected at an early stage, or cholera, or diarrhea, etc., these are very dangerous diseases. Fluorosis. Fluorosis is caused by the excess presence of fluorine. When we drink or use water for our domestic purpose, we have to see the fluorine level. The permitted fluorine level is 3 ppm, means 3 parts per million. If it is present in excess in pure water or in tanks, etc., and if we consume that water, we will catch fluorosis, in which the bones may bend or sometimes break. Similar is the case with hepatitis. If we can detect it early, then it is okay. Otherwise, this is also a fatal disease. Now, if we consider lead poisoning, due to pollution, there these type of metals like lead or mercury pollute the water present in tanks, which is used for domestic purpose. If that water, if it is consumed or it is used for our domestic purpose, then we consume lead, and if lead enters into our body, it is just like a poison. Next are the insect-borne diseases. These diseases are caused by when a person comes in contact with insects like chikungunya, dengue, malaria, yellow fever, Zika virus, Japanese encephalitis. Most of these diseases are caused by biting mosquito bite. Means mosquito is responsible for the spread of most of these diseases. Dengue again is fatal disease. Malaria and Japanese encephalitis or Japanese fever is also very very dangerous, especially for small children. Now, the diseases may also be classified on the basis of microorganisms which may cause the disease. For example, virus, bacteria, amoeba, protozoa, etc. causes the diseases, various diseases. Here we have few diseases which are caused due to virus. Influenza, Japanese encephalitis, dengue, measles, mumps, rotavirus, viral conjunctivitis, rabies, etc. Influenza or flu. It is caused due to virus. Few diseases may these few of these diseases may be in air-borne diseases, means sometimes these may be there in different medium. Here, influenza, if we consider, it is airborne disease and caused due to virus. Similarly, Japanese fever, dengue also, when we have mosquitoes, if they bite a person who is affected by the disease, and the same mosquito if bite the healthy person, that virus will be transferred from the patient to healthy person. As a result, the disease is transmitted and it will spread. Similarly, mumps, it is also a viral disease. Rotavirus and viral conjunctivitis. It is a disease of eyes in which redness of eyes are, and many things are there which are the symptoms of this disease. Rabies is caused by virus, but it is transferred due to dog bite, means dogs transmit this disease, or the host here is dog for this disease. Now, few diseases we can mention which are caused due to bacteria. Are bacteria responsible for these diseases? Diseases like cholera, leprosy, rickets, pneumonia, diphtheria, whooping cough, tetanus, plague, etc. This, these diseases are caused due to bacteria or infection due to bacteria. In these diseases, few are very dangerous. In olden days, due to cholera, many people used to die. Similarly, leprosy was incurable in those days. Rickets also, pneumonia affects lungs. If it is detected early at an early stage, then it is okay. Otherwise, the lungs may get damaged. Diphtheria, again, it is a fatal disease. In even in today's life, it is very dangerous disease. Tetanus also, plague. Now, in these days, plague disease is not there, but if it is there, it is very dangerous. Diseases caused due to protozoa like amoebiasis, malaria, worm infestation. These diseases are the, these diseases caused due to protozoa. Due to amoebiasis, loose motions will be there, and in malaria, person may have cold, fever, shivering, etc. Diseases may also cause due to fungus, and the parts of the body which may get affected are nail, feet, mouth, lungs, bones, etc. Now let us consider the stages of the diseases. What are the stages? Generally, we have four stages for any disease. First stage is called infection. The second is called incubation. Third is called manifestation of disease, and the fourth one is called termination of disease. First stage is infection, means the person is in this stage, the person will get infected, or the germs or microorganisms which cause the disease are transferred from person to person, and due to that infection, the disease will be transferred to that healthy body. Next is incubation. As soon as we get infection or when we get infected due to a particular disease, it may not be manifested because the germs will take certain time to manifest. During that period, there will be no signs or symptoms seen in that body or in that patient. That is called incubation period. For example, if we take coronavirus or COVID-19, which is the disease of the day, here after getting infected, after getting infected, the disease is manifested or the signs or symptoms are seen in that body or a person or patient after 14 days. The incubation period of the germs or virus which cause the COVID is of 14 to 28 days. In one person, the symptoms or signs are seen after 2 weeks, or sometimes in some person it may be seen due after 14 days to 28 days. So the period in which it is not manifested, the disease is not seen, or no signs or symptoms are seen, that is called incubation period. The third stage is called manifestation. In this stage, signs or symptoms of the disease in a person or a body are seen. We can notice the changes in the body. Therefore, this is called manifestation stage. Here, in, if we consider the COVID or coronavirus, fever, high fever, headache, breathing problem, loose motions, etc. are the signs of this disease. So these are manifested at this stage. Now, when we see the signs or symptoms of a particular disease, naturally we go to a doctor or we take medicine or a drug. After taking the drug for a particular period, the disease will get terminated. So that is called termination of the disease, and that is the last and fourth stage of the disease. The drug or medicine which we take, we may have to take for one day or one time or for many days or for a long period of time. Maybe it is one dose or maybe it is many doses, and the prescription may be up to for 5 days or 7 days sometimes, and for each day it may be once or twice or thrice we have to take the medicine. So it depends upon the intensity of the disease and type of disease, etc. For example, if we have headache, even if we take one tablet which relieves the pain, that means painkiller, then the disease may be terminated. For fever, it may be terminated in 2 3 days, like that. Now, let us consider about a drug. What is drug? Actually, we will deal this topic of drug in detail in some other lesson or class. Briefly, we will discuss about drugs in this lesson. Then, first thing, what is drug? We can define drug as any substance which is used in the prevention of a disease or to diagnose the disease or to treat or cure a particular disease in animals, including man, is called drug. So any substance, it may be herb or a synthetic or naturally occurring substance which is used to either to prevent the disease or is used in diagnosis or it is used in the treatment of the disease. In animals or man or in animals including the man is called drug. You know, many drugs like paracetamol, analgin, aspirin, brufen, etc., etc. We can divide drugs into different categories like analgesic, antipyretic, pain relievers, etc., etc., depending upon the diseases and also the diseases are caused either in organ or in system, etc., like circulate blood circulation or in respiration, etc., etc. Now, from olden days, we are using drug. Therefore, a Greek scientist, Hippocrates, defined a disease as a pathological process, whereas drug as scientific process. So, according to Hippocrates, disease is a pathological process and its treatment with drug is scientific process. It was defined in very back, long back. In that period, we don't have allopathy or any such type of treatment or science. Now, what the characteristics an ideal drug should have? Many substances are available as drug, but we cannot use all those substances. Then what we have to see what properties should be there in an, a drug substance which is to be called as an ideal drug. An ideal drug should possess the following characteristics. Number one, its action should be localized at the site. where it is desired to act. What is the meaning? The drug should act on that particular site, means if it is an organ, then it should attack that organ where the germs are present. Or if it is a system, then it should attack that system, like kidney or liver or head or lungs, etc. Or sometimes the respiratory system or blood circulation system or other digestive system, etc. So we say that it should act on that site. It is called localized or localization. Second is it should be non-toxic. The substance should be non-toxic or non-poisonous. If it is toxic or poisonous, then there will be ill effect on the body. Next is it should have minimum side effects. Sometimes a drug may cure the disease, but it will have side effects. Then the drug is generally abandoned, or it will not be used for a long time. But many drugs will have side effects. Therefore, we have to see that a particular drug is to be made available if it has least side effect. Next is it should not injure host tissues. Generally, these microorganisms will be residing in tissues, and those tissues are called host tissues. Naturally, the drug will attack on those tissues, but the problem is that it should not injure. Next is it should be efficient. The drug should be efficient. So the efficiencies of a drug is seen. If there are many drugs available, we have to choose the drug which is more efficient. Next is it should not make host tissues or cell resistant of the drug. If these tissues, etc., resist the drug, then the drug cannot act for a disease, or it cannot be taken as a drug. Why? Because these tissues will resist it, and there will be no action of drug seen during the use of the drug. So it should be non-resistant. But it is seen that in most of the drugs, they do not have one or the other characteristics. Sometimes a drug may be toxic, or some drugs may have side effects, or sometimes some drug may injure the host tissue, or in one or the other way, they do not possess all these factors or characteristics which are mentioned here. But to be an ideal drug, the substances which are used as drug should possess these characteristics, or at least many or most of these characteristics. With this, let us end the topic. We will deal in detail about the drugs in the next lesson. Goodbye.